So we are not in my little corner of the world.
No.
We're in his temporary corner of the world.
We're in San Francisco.
This is Rocky.
Hi.
He's my husband.
Thanks for having me, by the way.
Oh, yeah, thanks for
on your blog. This is great.
I'd have you more if you know you were home. Okay, so this video is going to be about the day of surgery, and I'm glad he's here because I was asleep for a lot of that. And
unfortunate for you, I have a really bad memory, so this should be fun.
Great. I should say I'm skipping my stats because I am out of town. Yes, because I don't like using other people's scales. So, because my scale is the same as my doctor's, so I just use those ones. I also have a list of stuff I took to the hospital with me. Stop looking at me, it's weird. I knew I was going to be in the hospital only one night and that I was leaving early in the morning, so I didn't pack toiletries or a change of clothes or anything like that. My doctor, my surgeon, wanted me to pack like milk of magnesia. What's happening?
So I was just taking a picture of the view with the camera because I want everyone to see what we're looking at. All right, continue. Thanks.
Oh my god. Okay. I, before surgery, had really bad IBS. I would go to the bathroom anywhere between 3 and 10 times a day. Constipation obviously is a worry for people that have the surgery.
And furthermore, let me just add to that, that IBS and those like issues you had completely changed the way you were living your life prior to surgery.
Yeah, we're skipping to like episode 4 and 5.
Okay, well, we'll get to that at a later date.
Jumping ahead.
We'll get to that at a later
ahead.
date. Stay tuned. Exciting things to come.
Right. Anyway, they wanted me to take milk of magnesia start taking it like the day before or the night before. And I was like, I am not going to do that because I already go to the bathroom so much. But I did take it to the hospital just in case. They were saying that if you don't go to the bathroom after 3 days, start taking like stool softeners and like a fiber gummy, something like that.
Fiber gummy.
After 5 days, you probably want to give yourself an enema. And I was like, no. I didn't have any of those problems though. I went to the bathroom the next day. Wow, I went off on that one for some reason.
Because it was about constipation and poop.
Yes, it's a thing.
That's a good topic.
I bought Gas X, but I didn't take it with me because, again, I knew I was coming home early, so I was like, I'll just take it when I get home. But right when I woke up, they're like, here's a Gas X strip. So they gave me a Gas X strip.
Yes, I remember that.
Anyway, I took a book to read. I took a word search book. I took my iPad, my phone. You took me, actually.
Okay, that's true.
I took a pillow for the car ride, so not for on the way there, but on the way back, it's nice to like hug a pillow against your stomach. Feels nice instead of like the bumps and hitting the seatbelt and all that stuff. So yeah, that was basically that's pretty much all I took to the hospital. I didn't take anything.
You took that flannel with like the loose fitting flannel with the buttons?
Yes, I wore loose fitting clothes.
Yeah.
Which is down there. I have
no. Oh god, I'm just skipping ahead.
I've got notes. You're really messing up my vibe.
Then you just give me the cue and when to talk and then I'll just do that.
Okay, you talk when I say, and then I went to sleep.
Okay.
For the night before, though, they did want me to shower, obviously. They're going to give you so much information, like, don't ever be worried, like, oh, what do I do? Because I don't know, my surgeon basically held my hand through the entire thing. So I got a packet of, so weird, they're kind of like baby wipes or wet wipes or whatever. And so after my shower, I had to wipe my stomach down with that, let it dry, and then I got dressed. And then in the morning, I had to do another wipe again before I went to the surgery center. So he didn't even get in until about midnight.
Mm-hmm. Yeah, I flew in.
Yeah, because he's a traveling man.
I'm a traveling man. But it was really important that I was there for the surgery because it is a major surgery. So even though he was only going to be in overnight, it's good to have someone that you
definitely, especially because you can only lift 10 to 15 pounds. So I mean, it did feel uncomfortable to bend over in my stomach, but we'll get to that in a minute. So the morning of, I also took my blood pressure medication. This is one thing that I wanted to find out that nobody talked about on YouTube. Because I just kind of assumed everybody, not everyone, but a lot of people that had the surgery would be on high blood pressure medication because that's one of the side effects of being so overweight.
This is like a useful tip coming up right now?
Well,
a thing to know?
Well, I didn't really have to worry about it because they just really helped me out. They just told me.
Okay.
But basically, if you have blood pressure medication and you're worried about taking it, they told me to stop taking. I took hydrochlorothiazide, which is just a diuretic. So they just told me to stop taking that for 2 weeks. And then I was on metoprolol and I was on the extended release, and my surgeon wanted me to be on the quick release because the extended release has beta blockers. Doctor words, I don't know. So basically I was on that, and they say you can take it in the morning with a small sip of water. Not a big deal. And it doesn't matter because, like, an hour before my surgery, they gave me, like, 3 pills to take with half a glass of water. So once we got to the surgery center, I was kind of nervous beforehand. Like, in the morning, I was like, oh, my God, they're going to cut me open. It's going to be so scary.
I thought you would be a lot more nervous than you were, though. Or if you were nervous, you held it in pretty well.
When we left and when I got there, I wasn't nervous at all, because I was like, I can get up and walk out. Like, I don't have to do this, and I'm choosing to do this. So,
but isn't there a part of you that, like, you went through so much to get to that point that, like, it'd be hard to walk out at that point?
Yeah, like, staying was gonna be better for my life than leaving.
That's true.
And I mean, it just
good choice.
I know. It made the decision.
I need to get my drink. Keep going.
Will you grab my water?
Sure.
It made the decision very easy.
You're a huge water.
Whatever. You get to the surgery center. I checked in, gave my ID. Thank you, sir. It's huge.
Okay. What'd I miss?
Absolutely nothing. Checked in. They just needed my ID, my insurance card, the usual things. Make sure I'm really who I am and why I'm there. Whatever.
All right. Your name's Kimball Davis. You're at what surgery are you having?
Pretty much.
What's your sign?
They called me back. Once they called me back, I was like, oh my God, here we go. There's no turn back now. I don't know. Whatever. So we get back there, and the nurse was new at the facility. He was a
nice way of putting it.
He was a very nice gentleman.
So nice.
Well, he was very nervous, but it's because he was like trying to learn all their things. So he would have to like kind of leave and come back a bunch and ask them like, did I do all this right? Whatever.
Yes, he was very lovely, but needless to say, it's kind of unnerving when you're going to have a surgery and then like everything they say to you is more of a question. Like, do we give you the IV?
Okay, it wasn't that bad, and you got stuff in your teeth. So
do we?
No, he was not that bad. He was just nervous. He was actually very good at the IV.
He was. That was awesome.
I did not feel a thing.
That was good.
And honestly, the 2 most things that I was nervous about the surgery was getting an IV and feeling that burning, gross sensation when they put the anesthesia in. And I didn't feel either of those.
No,
so,
you did a good job. Good job, nurse.
Yes. So basically, he kind of just went over everything. I had to sign some waivers, and you might die, because that is always a possibility. But I don't know. Dr. Patterson has done nearly. God, it may be over 4,000 surgeries by now. So I really was not nervous about that.
I think
I was in good hands.
That's something really important. Like, you did a lot of research about who was doing your procedure, and we were lucky we lived in Portland where she was actually working.
Yes, I researched everybody in the Northwest.
But if you are considering traveling for the surgery, you should really look into her, because she really is, like, even when you talk to her, she's awesome. Very intelligent and very committed to making sure that like she has a clean record, and like she is going to do the best job that she can for you. She's definitely committed to her patients, so I highly recommend Emma Patterson.
She's awesome. Mm-hmm. So I got changed in my gown.
She's
I had to
sassy too.
I had to wipe my stomach down again just one last time, and then I got to meet everybody that was going to work on me from the team. I met my anesthesiologist.
They were like a bunch of characters too. Like they were wearing like floral bandanas and shit.
Yeah, like Hawaiian get-ups and whatever. But yeah, and I talked to my surgeon one last time right before I went back. She was just like, "Do you have any concerns, questions? Last chance. If there's anything you really want to know." And I was like, "No, dude, you told me everything, so I was good to go."
Good to go.
I don't remember the guy's name, but he came out and he's like, "Let's go back." So he wheeled me back. I was like, "Okay, bye, Rocky." I think he went out to lunch.
I went to Taco Time. I got some delicious crispy bean burritos.
It's a good use.
Anxiously awaited for
an hour
to come back.
So I get into the surgery or the operating room. They had me like move over onto the operating table, which I was like, "Oh my God, this is gonna be so difficult." Because other people talking about like, "You want me to move onto that tiny little table?" And oh my God, and I was like, "Okay, seriously." It was like they shoved my bed right up to it, and they just kind of like helped me scooch over. So it was not a big deal. Maybe my
don't diminish everyone's experience.
I'm just saying, maybe my team was a little bit cooler. Like
maybe
they were there for me.
They were pretty cool.
So we're all chatting. They reminded me
of a biker gang, actually. Anyway.
Okay. So they're all chatting, and I was kind of chatting until they put the oxygen mask on me.
They're all okay.
And like the surgeon wasn't there, and everyone's just kind of looking around. And then she like walks in, and she was like, "Oh God, I'm sorry, you guys. I was locked in the women's bathroom." So I heard that, and everyone was like, and I fell asleep laughing. That's the last thing I remember. Actually, no. The last thing I remember was seeing the surgeon's assistant, the huge lights behind her, and she was like looking at me like smiling, and then her face like exploded with color, and like lines of color like went out to the side, and then I was asleep. That was the last thing I saw or remember.
That's the PG version of that story, but we'll move on.
Yeah, I'm not telling the others the real version.
All right.
I don't want to like.
No, I know. Yeah, go on.
There's some other things that happen. Whatever, it doesn't matter.
Well, like what you think the internet's plastered with like
it was
complete
funny.
truths?
It was funny, and I felt
That's
sick
okay.
laughing.
This is just called extraneous. It's not a lie. It's just extraneous.
Shut your face.
Okay.
I was out. He went out to eat some taco time. I woke up. I don't really remember being groggy, but apparently I was groggy. I remember snapping out of it, like not feeling groggy, and they asked me if they wanted Rocky back there, and I was like, yeah, go get Rocky.
But see, the thing is that's weird for me is I went out and I was gone for a long time, and they said they would call me. Because I came back from eating taco time. I was at the nurse. I said, hey, when is he going to be done? They said, oh, they're just sewing him up right now. So the procedure went really quick, but then another like hour went by, and no one came out to get me, so I was like...
Probably like wake me up.
Maybe. But
I don't think they would get you when I'm like.
So anyway, I went back to the nurse after about an hour after they said they were zipping you up or whatever they said. Dr. Emma Patterson came out and like talked to me, and she explained that everything went really well and that you were just amazing, and she just loved you, and she liked the hair patterns on your belly and all that. So she had good things to say.
The hair patterns on. Did she really say something about?
No, she didn't say that.
I was like. So anyway, Rocky came back. We chatted. I was in my own room.
And you were cognizant very quickly.
Yeah, I don't really have a problem with anesthesia. I don't think I ever have.
I do.
Yeah,
I hate anesthesia.
Really does.
I hate it. I feel like I'm dying when I wake up from anesthesia.
Let's see.
Dying.
When I woke up, I had zero pain. My first thought was, oh, something happened and they couldn't do the surgery. I seriously thought they couldn't. Because I was like expecting...
Did you really?
I did.
You never told me that.
Well,
why do you keep things from me?
I'm sorry.
Okay.
Yeah, no, I didn't feel any pain. Of course, I wasn't moving, but no, I didn't feel pain the entire time. I kind of just felt like my stomach muscles, like I worked them out really hard at the gym the day before, and so they were really like kind of tender. But I was still able to move around. It was only when I actually did like a sit-up that I actually felt my stomach muscles, but the incisions never hurt. My stomach didn't hurt. I didn't feel nausea. I didn't get sick. No throw up. I had like zero issues with the whole thing. So I had to drink water, and he was. Well, not water, but protein shake. 1 ounce of protein shake and 1 ounce of like G2 Gatorade.
There was a third drink. What was it?
It could have been water. Like if I wanted something thinner.
Yeah.
Maybe. But
So it was my responsibility to make sure that he had adequate liquid, and I messed it up and gave him too much. I thought he was supposed to have one every 20 minutes, not every other. But the form was confusing.
Doesn't even
It was
matter.
confusing.
It really doesn't matter. I had zero issues with the liquids. I didn't have any problem with it.
Good. I failed.
We did a couple laps. I did quite a bit of walking.
You walked really quick, actually. It was within an hour of you waking up, I'm pretty sure.
I mean, granted, like the chair helped, like the bed helped me sit upright. So did a couple laps. After a couple hours, or maybe even an hour, I did have to go pee. And so they make you pee in a jug. Well, I don't know if they always do, but
because they measure how much liquid's coming out. Basically.
Yeah, they want to make sure like I'm getting in enough ounces and not like peeing out too much or whatever. I don't know.
I think that's also how they measure if you're leaking or not, because they didn't actually do a leak test on you.
That's not how you do it. The leak test is you have to drink like a dye in front of a machine and it shows your stomach.
But you didn't even do that.
It's because she's that good.
She's that good.
She is that good. It's getting sunsetting a little dark.
And did you feel any gas pain at this point?
I didn't really feel any,
like in the chest area?
Any gas pain. Dr. Rattler, the surgeon's assistant, because I asked her about it, she's like, yeah, no, we really try and get all of that out. I definitely didn't have any, there was no pain. Like, I never had shoulder pain, back pain, chest pain, any of that.
From the air?
From the air, yeah. I think I felt it like a day, like the next day sitting in my rocking chair, but it didn't feel like acid reflux, it didn't feel like pressure. I was just like, oh, it kind of feels like maybe a tight muscle or something.
Because for those of you that don't
really
know,
really mild.
They cut you open to do these laparoscopic.
The first thing they fill you with air. Yeah, they fill you with, what is it, CO2, I think?
Yeah.
And that's like the first hole, and they...
Whoop. But it makes a cavern that they can work in so that everything's not just piled on top of each other. But that air gets released into your body after surgery, and it can cause people pain, like in their shoulders and chest if they're upright.
Can't get it out.
But the more you walk around and the more you take like Gastric strips, the more that actually helps with that.
I'm not 100% sure about the Gastric strips because that's like intestinal, but everyone swears up and down that it helps. And since they gave me one, maybe that's why it helped so much. I don't know. Also, I will say the only thing that really hurt through the entire thing, this is so dumb, is that I got, so they had to do it was a test to see if I needed to have a blood thinner shot, and I did, and I didn't want to get one, because I hate shot. I don't mind getting blood drawn, but I don't like getting injections of stuff. It, like, weirds me out. And that they had to do it in my stomach. I've never had a shot in my stomach before.
That was fun.
So that was the only thing that hurt, and that hurt for a few days. Like, not constantly, but like when I bent over, it was tender.
What did it feel like? Was it a sharp pain, or was it like a...
Afterwards, yeah, it was just like, I mean, it wasn't like terrible. It wasn't like, oh God, it was just like, ugh.
But did it feel like skin surface pain, or did it feel like internal pain?
No, it was...
Okay, so it just felt like a scratch on the surface or something.
Yeah.
Okay,
it was just, it was annoying more than anything.
It's the end of the world.
Rocky went home, and then I just
This is illustrating me leaving.
Oh, bye. I was like, see ya. And then I hung out with my nurse, Christy. She was cool. She was the night nurse. We chatted for a bit. She looked at my scars. They looked good. They just did like the internal sutures and then put like the skin glue on it, which is awesome. I just left that on for like 10 days.
Because it's like this clear glue that goes over your skin and it bubbles out, but then nothing scrapes your incision.
Nothing touches the incision.
So. And you can shower with it.
Yes. I didn't do anything. Like, all the stuff that I brought, I just left in my bag. I was like, I'm kind of exhausted. It's been a long day. So I watched a bunch of Married with Children because that was what was on TV. I tried sleeping. It did not go very well because when I sleep, I kind of breathe shallow. So my oxygen alarm would go off, or my blood pressure would drop too low and that alarm would go off.
And you had that oxygen thing that you had to keep breathing, remember? They made you like breathe through that too? Video. Oh. Well, yeah, he had a lot of that.
That was like the first appointment that I had with them ever.
Yeah, but they made you do that too at the actual procedure. The expander thing.
No, it's not expander. It's the spirometer or whatever it is.
Spirometer. Sure.
Anyway, I was awesome at that, apparently. I was like...
Yeah, but I was better, so...
I'm sorry, did you have 5 holes in your
It doesn't matter, I was better at it.
Whatever, so I got it up there, and they're like, wow, okay, just settle down there, crazy.
Whoa, crazy.
And then, and also my IV bag, whenever that needed changing, that alarm would go off. So yes, I was up all night. I probably got like an hour of sleep tops. So the next morning at 7, the surgery assistant, Dr. Rattler, came in. She's awesome. She was like, hey, you're looking good. I did the spirometer thing for her. She was like, oh, that's awesome. Okay. She's like, you are good to go whenever you want to leave. Because I was feeling awesome. And Rocky was on his way, stuck in traffic, but he got there around 7:30. She said it was probably going to be 8, but she got in early. So
okay, well, good for her. Good for her for getting up and getting her Starbucks.
Wasn't even a big deal. Oh, and while I was in the hospital, I asked them, because I was like, I don't feel pain. Like, how much pain medication am I on? Like, what are you guys giving me? And my nurse is like, we're not giving you any pain medication. I was like, oh, that is awesome. But before I left the hospital, I did take a pain pill, because the car ride, I didn't know the bumping, and it was like going to be a 20-minute, half-hour car ride, so.
What was the pain pill?
Oxycodone.
Oh, just a little oxy, gotcha.
Just a little
no
oxy.
biggie.
We got home, and then I took like a 3-hour nap, and then when I woke up, that is when I started my new life.
So how were you emotionally feeling when you woke up from everything? Because a lot of people get like a little freaked out because they realize that like a part of them's missing. What did you feel?
Well, yeah, the part that did this to me. No, I felt great. Since I had researched it so much, and my mom had surgery as well, like years and years ago, I knew what I was getting into. I knew what to expect. I wasn't worried about anything.
So you had no regrets?
Oh God, no. I mean, I'm a little scared because some of the bills are coming in.
What were you nervous about when you woke up?
Well, okay, I wanted to make sure that I had a bowel movement.
Okay.
Because I did not want to deal with constipation. I had a bowel movement the next day. I think I already said that. I didn't want pain, but I didn't have any, so that was good. And I think I was most scared, honestly, about throwing up, because that is something I just think is the worst. That never happened. They also gave me a patch for nausea, whatever, and I had to leave that on for like 2 days, I think. Rocky was there for a few days. He was there just long enough to where, like, once he left, I felt comfortable bending over, putting on shoes, pulling up my pants. Like, I mostly sat in a rocking chair so I could just, like, rock myself to stand up.
I think that's a really good point. If you're thinking about doing this surgery and you go forward with it, make sure you have someone there for like 2 or 3 days, or someone that's accessible, because you can't do a lot of bending. Even simple things like putting socks on is a chore.
Yeah, and I did tell 2 of my neighbors that are really good friends, because I didn't tell a lot of people about my surgery, because I didn't want to hear their opinions, whether they agreed with me or not. Now I don't care, who knows. I did tell those 2 neighbors just in case I needed their help, and it was nice knowing that they were there. So in the next video, I will talk about the post-op diet.
Ooh, post-op diet. Do you have any like tips for people in the next one?
I don't know, you kind of just take from this video what you want.
Well, thanks for having me. When's the next video?
Next Tuesday.
And you'll be here?
I will be
here till the 14th of May.
Still be here, yes.
Okay.
I think I'm here longer.
Wait, do I get to be in the next video?
If you want to. Depends on how busy you are.
Kind of want to be on it.
Okay, yeah.
Okay, great.
I'm like, if you're not so busy.
Let's do everything together.
Okay. Yeah, because the next video, it'll be about the post-op diet, and there was something else that went along with it. You'll just have to wait a week to find out what it was, because I don't remember. I hope that if you haven't had your surgery, that I hope that when you do, because if you're thinking about it, you should probably do it, because I waited 10 years to do it, and it's a bummer that I waited. Well, I'm bummed that I waited.
We'll talk about that later, because your life has completely changed since you've done it.
Yes. And it's only been, 12 weeks?
I've known this guy for over 20 years, and he, in just 3 months, everything's completely changed. But we'll talk about that later.
Yes. Life is different.
Reasons to keep watching.
But yes, if you're thinking about doing surgery, I would highly recommend it. Who knows, you may have 0 issues and it'll be the best decision of your life. Even if you do have complications, I still think it's worth it. It's a small time in your life that you're going to have to go through some hardships to have a very good, fulfilling life afterwards.
That's a good message to end on.
All right.
Let's go edit this now.
Bye.
Bye.
Oh, editing.